all know me, I'm Valerie, and I am going to I'm going to be leading on this session. It will be recorded, and I think Joe has started the recording, so we are recording this session. So if you don't want to be recorded, use the chat function. If I could please ask you to turn off your video and also your mic, that would be much appreciated. It can get a bit distracting when it's such a large group of people. You could turn off your microphones, please. That would be really good. Thank you. And if you do have any questions, please write them into the chat area, and Joe and Raj are keeping an eye, and they'll pipe up with any questions, and also there'll be opportunities at the end for any questions. So this is a session that's mandatory for group 2, so people are going to be giving health protection advice, and it's optional for all of you, and everybody is very, very welcome. It's great to see you all here. And we do get asked a lot of questions about PPE. It's obviously a very hot political issue at the moment, so this is why we're getting, or why I'm doing this session. So the aims and objectives. So by the end of the session, you will hopefully have an understanding about PPE and how to use it safely. You'll be able to advise on the use of PPE, and also, and just as important, you'll be able to advise when PPE is not required. Most of the people on this call do not work providing direct care in either health or social care. So most of you have probably never used PPE yourselves, although I know some of you will have. This is not training in how to use PPE, that's quite different. This is training in an understanding and be able to advise about the infection control and health protection aspects of PPE. And these are the topics that we're going to cover. So we're going to look at what is PPE, when it should not be used. We're going to look at different types of PPE, and we're really going to look mainly at gloves and face masks and face coverings, but we're also going to look at aprons, gowns, overshoes and face visors. We're going to talk about how to dispose of PPE and how to remove it very briefly. We're obviously going to be talking about PPE as it relates to COVID-19, because that's why we're all here, and what PPE is required for COVID-19 and what circumstances. And also there's going to be a bit at the end about myth busting and a fun what's wrong here picture quiz. So that's really what we're going to be covering in the next hour. And as I say, any questions, just type away into the chat function at the side. So PPE is any protective equipment that protects the user against health or safety risks at work. We tend to think, and obviously given that we're in a pandemic of a respiratory infection, we tend to think of personal protective equipment as it relates to healthcare. And I'm very guilty of that because I'm a nurse, I work in public health, so I do tend to think about it as healthcare. But of course it's much wider than that. So all of these are examples of PPE. So a high-vis jacket that somebody wears when working on the motorway, that is PPE. A hard hat and hard boots that protect people from falling objects, safety harnesses, all of these items are personal protective equipment. And this is all enshrined in law. So the Personal Protective Equipment at Work regs from 1992 state that employers should provide suitable personal protective equipment to employees, and so that risks at work can be safely managed. So this is a legal requirement for employers to ensure that their employees have the PPE that they need to do their job safely. And there's a lot of information. I put a lot of links into this presentation, and obviously this will be sent out at the end, so if you want more information, do follow the links. But there's a lot of information there about PPE. Excuse me. It's important to remember that PPE is actually the last resort, and it comes behind all the other control measures. It's probably the least effective of all the control measures, and that's perhaps a little bit counterintuitive. Certainly at the moment, we tend to think of PPE as, you know, it'll keep us safe. It's going to magically protect us. And yes, it can protect us, but actually it is probably the least effective of all the control measures. If you're wearing a mask and your mask fails, then it's a failure to danger. You are at risk of exposure. So there are a lot of other control measures that need to come first. So things like physically removing the hazard. So in this case, we're talking about COVID-19. We want people who are symptomatic to stay at home, to isolate at home. We are substituting, we're all changing the way that we work. Most of us on this call are listening in from home. We're all working from home now. We're isolating the hazard. We're doing other things like washing our hands more. We're doing training. We've got signs and information. So all of these control measures are very important, and PPE is really the kind of last resort in the hierarchy of controls. And things like social distancing, respiratory hygiene, hand washing, isolation and quarantine are far more important than PPE. That aside, this is a session about PPE, so that's what I'm going to talk about for the rest of the session. So I do like my history. Those of you who know me know I always bang on about the history of medicine, but PPE is not new. So Pliny the Elder, the guy on the far left there, he was a Roman philosopher, and he made masks out of animal bladders, and he used those masks to filter dust when they were crushing up minerals to make paints and pigments, because these were toxic. So back in, ancient Rome, they were using PPE to protect the wearer. The second image you'll remember from my intro session, it's a plague doctor back in the medieval times. During bubonic plague, people wore these gowns and masks stuffed with herbs to try and protect themselves against the bacterium that causes plague, probably not very successfully. The third image, that's soldiers in World War I, and they're all wearing respirators. They're wearing gas masks. And of course, chemical warfare was used in World War I. It's been used since, sadly. And these masks are PPE to protect the person wearing it. And then the final image on the right, it's HIV, the HIV virus. And really, it was the 1980s that the PPE in health and social care really changed. And it was really because of HIV and the discovery of HIV. And at the time, it was realised that somebody could be carrying HIV or other viruses like hepatitis and have no outward signs of ill health. They could look absolutely fine, but they could be carrying this virus. Of course, at the time, in the 80s, it was absolutely deadly. There were no antiretroviral drugs. There was nothing one could do about it. People died quite quickly. And so really in the 1980s, the concept of standard precautions was developed. And really that's the concept that all in healthcare and social care, all blood and body fluid is treated as potentially infectious, because we can't tell by looking at somebody if they're carrying HIV or hepatitis. So we treat all blood and body fluids as potentially infectious. So PPE in the 1980s really was quite revolutionized as a result of HIV. So how does it work? The whole point of PPE is that we're trying to break the chain of infection. So I've shown you this diagram before, and this is how infections spread. And for infections to spread, you need to have an infectious agent like SARS-CoV-2, which causes COVID-19. It has a reservoir, so it lives in bats or humans. It gets out of us through droplets and coughing and singing. It's spread by droplets and contact. It gets into somebody else through inhalation or through contact. And susceptible hosts, that's pretty much all of us at the moment. And the whole point about PPE is it's designed to break the chain of infection. And we do that at the portal of exit and the portal of entry. So if somebody is wearing PPE, that will prevent them excreting or that will prevent the COVID-19, the virus from leaving them, and also it will protect somebody who's wearing it as well. And the type of PPE that is used completely depends on the mode of disease transmission. So, and I'm going to go on to this in this slide here. So on the on the right there, you can see how diseases are spread from humans, and they can be spread by contact, so direct contact, we can shake hands or we can touch somebody, or it can be indirect contact, so through a door handle or something, or it can be droplets, which are these very large respiratory droplets here that we all release when we talk, we cough, we sing, and they fall to the ground quite quickly. Or some infections are airborne, so infections like flu or TB are in these aerosols, which are these much smaller, finer respiratory droplets that can stay floating in the air for many, many hours. Or fecal oral, so contaminated water or food. So that's really how infections are spread. And the PPE you wear depends on how the infection that you're protecting against is spread. So if you're worried about, so TB, for example, which is an airborne infection, then you're going to wear a mask because that will protect you from these aerosols here. If you're worried about something that's spread through fecal oral route, you're probably going to wear gloves and aprons if you're helping somebody clean up after they've been incontinent of feces, for example. So the PPE worn depends on how the disease is spread. And we know that COVID-19 is spread by contact, so direct contact and indirect contact, and also through droplets, through these big, fat, heavy respiratory secretions here. There's some theories that it might be airborne, that it might be present in these aerosols, but we don't know that. That's not been proven. We're not sure. That may be a route of transmission in hospitals and in some high-risk environments, but it's probably not significant in the wider community. We're looking at droplets and contact really as spreading COVID-19. So, any questions so far? Anything on the chat, Jo?
Nothing on the chat, Valerie.
Lovely. So, why do we wear PPE? So, anyone want to shout out, or anybody want to write? Why do we wear it? What's the point of wearing PPE?
Claire said protection.
Protection, absolutely. Protection of who?
Anna's commented to protect us.
Yeah, so PPE, like most things in health protection and infection control, it's not as simple as you might think. I've seen a lot of people recently saying, oh, you know, it's not rocket science. Well, no, it's not rocket science, but nor is it simple either. So we wear PPE to protect us, and PPE can protect the person wearing it. So if I am a nurse or a doctor and I'm going to change that dressing there on somebody's leg where there is blood present and possibly pus, I would want to wear gloves to protect myself from anything that might be in that wound. Equally, if I am going to, in a care home, assist somebody, a resident, to use the toilet and clean them up afterwards, I'm going to wear gloves to protect me against any organisms that will be present in the feces. So we wear PPE to protect the person who is wearing the PPE. But we also wear PPE to protect other people. And the classic example of that is in surgery. So many of you, some of you will have had an operation. And obviously during surgery, we are cut open, our skin is breached. And you'll remember from Neil's lecture that the skin is the biggest barrier we have against infection. It's part of our immune response, but we've cut open the skin. And so it's really important that a sterile field is maintained. So during surgery, anybody who is operating is near to the sterile, to the surgical site, is wearing masks, gowns and sterile gloves to prevent any contamination of that surgical site. And also anybody who has contact with the surgical instruments, again, is wearing a sterile gloves and sterile gowns and the sterile drapes there. So this sterile field is really important to protect others. So PPE, we wear it for two reasons. We wear it to protect ourselves, but we can also wear it to protect others. And of course it can do both. So the surgeon who's operating here is wearing sterile gloves to stop any pathogens being introduced into the patient, but those gloves also protect the surgeon from contact with the blood during the surgery. So they can do both, but we wear them to protect us and we wear them to protect others. There are lots of different types of PPE, and I'm going to go through all of these. I've included hairnets, which I'm not really going to discuss, but we're going to talk about gloves, we're going to talk about masks, visors, gowns and aprons, overshoes, which is a bit of a bugbear of mine, but we're going to look at these in a little bit more detail now. And what do we wear them for? How do they work? So gloves, I've kind of touched on this already. Gloves, there are two types of, well, there are lots of types of gloves, but you can break them down into two main categories. You've got non-sterile gloves and you've got sterile gloves. So we've talked about sterile gloves already. They protect that patient who's having surgery, and it's all about maintaining a sterile field. And if any one of us is to have surgery, we absolutely want the surgeons, the nurses, the practitioners who are doing that operation to be wearing a sterile glove, because that will keep us safe. Non-sterile gloves is what I'm going to talk about in more detail, because that's really, they're used far more often in healthcare, and it's really what we're talking about in the context of COVID-19. So non-sterile gloves, they protect the person who is wearing them. So you know, somebody's wearing gloves, they protect that person. So here, for example, we've got another leg wound. I'm not going to show any gory images, by the way. I normally try and pack my presentations full of gory wounds, but I'm not going to do that because I know some of you might not appreciate that too much, but I'm a nurse, so I do like that. But here we've got somebody who's got a leg wound, and there's obviously blood there and probably pus, and this person here is dressing it. So they are wearing non-sterile gloves to protect themselves against any bacteria in the pus or any bloodborne viruses that might be present there. So the person's wearing them. The patient here, the person whose leg this is, he or she is not benefiting from those gloves in any way at all. Those gloves aren't sterile. They're in a box, they're hopefully clean, but they're not sterile. So this patient doesn't benefit from those gloves in any way, shape or form. The person wearing them benefits. It keeps the person safe from any pathogens that might be there. And gloves are interesting. Gloves can be misused, and I'm going to talk about that later on. But with gloves, it's really important that gloves are only used for each task. They should be put on immediately before the activity. So the person cleaning this leg wound should clean their hands and put on the gloves immediately before changing that dressing. And then as soon as the dressing has been done, they take off the gloves and they clean their hands. You should never, if you go into a care home or a hospital or any health or social care environment, you should never see staff walking around wearing gloves. You will do, sadly, but you shouldn't. They should be put on, used for the task, taken off, and the hands cleaned. Gloves as well are not a substitute for hand hygiene. We can't be certain that there aren't tiny little holes in those gloves. We don't know that. We don't know if when the gloves are taken off that the hands aren't contaminated. So people often think, oh, I've got my gloves on, I don't need to clean my hands, and that's absolutely false. So whenever gloves are removed, then the hands must be washed. And again, gloves are for one task only. So if this person is changing that leg wound and then is going to help the person brush their teeth, you wouldn't want to wear the same gloves for the leg wound to the teeth brushing. You would take them off, clean the hands and put on a new pair. So non-sterile gloves, they protect the wearer, and they should be used if there's ever contact with blood or body fluids. So brushing the teeth, cleaning the dentures, cleaning a leg wound, cleaning up somebody who's been incontinent of urine or feces, anything like that, non-sterile gloves are required. Sterile gloves, really for surgery and aseptic procedures only. Any questions about gloves?
Nothing on the chat, Larry.
Fabulous. We're going to come back to gloves later. Plastic aprons. Again, aprons and gowns are worn if there is anticipated contact with blood or body fluids. So if you are working in a care home or in domiciliary care or a hospital and you think there is a chance that blood or body fluids might splash onto your clothing or your uniform, then you would wear an apron. So the apron provides pretty good coverage, but you might want to wear a gown if there's going to be a lot of splashing, because it just provides greater coverage. You can see here that the apron doesn't really cover the arms and it doesn't cover the neck area, whereas a gown would do. So aprons, gowns are great for protecting any contamination of blood or body fluids. And again, like gloves, gloves are single use. You use them once, you throw them away. An apron and a gown are single use. You use them once and then you dispose of them immediately. So again, you should never see people ambling around wearing aprons and gowns for any length of time. Face visors and eye shields. Again, it's a bit of a theme here, but they should be worn if there's any chance that blood or body fluids can splash into the face or the eyes. And all these are doing is providing a physical barrier. So, you know, this is a pretty good face shield. It's got really good coverage. It's covering the eyes, the nose and the mouth, all of which are portals of entry for infection. Those are the ways that infection can get into our bodies. So if we've got this physical barrier between the portals of entry and the wider environment, then that protects the person wearing it. So these protect the person wearing it. They could also protect others. If that person were to sneeze while wearing a visor, the droplets aren't going to go very far. Obviously, a face shield like this provides more coverage than an eye goggles like this, but both are useful. Don't rely on glasses. Some of you will wear glasses and you'll think, well, that's okay, they will protect my eyes. Well, but they won't. I used to be an ITU nurse and I once had a splash injury into my eyes while I was wearing my glasses, because glasses are designed to correct your eyesight. They're not designed to protect your eyes from splashing and contamination. So if there's ever a chance that somebody has to, that may be splashed, then you want visors and eye shields. So shoe coverings. I've included this because we actually had a question about this, I think probably way back in February or March, perhaps it was. And shoe coverings are an interesting one because they used to be used a lot in theatres, and you can see the picture there, somebody who works in theatres, he's got scrubs on and shoe coverings on. And they're still used sometimes in the food industry as well. But really that there's no evidence that shoe coverings are effective at reducing cross-infection. In fact, there is evidence that people contaminate their hands when they're putting them on and taking them off. And if our feet on shoes are dirty, it kind of doesn't really matter because our feet aren't renowned for spreading infections, but our hands are a really good way of spreading infections. So if I contaminate my hands because I'm putting something over my shoes, that's a real problem. So they're really not genuinely recommended for infection prevention and control purposes. The floor is always going to be dirty. The floor, even in an operating theatre, which is a really ultra clean environment, the floor is always going to be dirty. And overshoes are generally not required. They do have their uses in some areas, like ultra clean areas where you're making sterile goods, you know, sterile equipment, for example, but really they're not required and they're not useful PPE as far as cross-infection is concerned. So I'm now going to go on to masks. Masks are, so far it's fairly simple, you know, gloves, aprons, visors. You use them all if there's a risk of splashing or if you're coming into contact with blood or body fluids. It's fairly straightforward. Masks are slightly trickier. Now there are two main types of mask here. So this type here, which is a fairly loose fitting mask, and this type here, which is a very tight fitting mask. And I'm going to talk about the two different types now, and what they are and how they work. So the blue one here on the left, this is a surgical mask. And all it does is provide a physical barrier between the person wearing it and the wider environment. That's literally all it is. It can stop droplets, it can stop gross contamination. It doesn't filter. So a surgical mask is very effective. So it will stop these big, fat, heavy respiratory secretions here from entering the nose and the mouth of whoever is wearing this mask. But these finer aerosols that are floating around and hanging around suspended in the environment for several hours, this mask is not going to filter those out because it's not a respirator mask. And a surgical mask, it protects the person wearing it, and it also protects other people. And there's been a bit of misunderstanding around this, but it actually does both. So if I'm wearing a surgical mask and I have COVID, but I don't realise it, that mask is stopping my respiratory droplets from going very far. It's blocking them. So that protects anybody else that I might come into contact with. So that's a good thing. But equally, if I am wearing this mask and I am working in a care home and I can't maintain social distancing because I have to look after the residents, if one of the residents has COVID-19, by wearing that mask, I'm protecting myself from their droplets as well. So it protects the wearer and it protects others, and it blocks droplets, but it doesn't filter out those finer aerosols. Any questions about surgical masks?
Nothing on the chat.
Fabulous. So the other type of mask is what we call a respirator. And the difference is that this one is very tight fitting. This one isn't, it's loose. When I say loose, it's not flapping around in the wind, but it's not tight fitting to the face. This one is really tight fitting to the face. And this respirator mask will filter, and it will filter and stop these tiny aerosols, which are much smaller than the droplets, from entering the nose and the mouth of the person wearing the mask. So these masks are really useful for infections like TB that are spread through the aerosol route, and also for infections like flu or COVID-19 when somebody is having an aerosol generating procedure. If anyone's interested, there's a list of all the aerosol generating procedures there. But there are some medical procedures that we do to people that will produce aerosols. So things like bronchoscopies, when tubes are put down into the bronchus to have a look and see what's going on, or if somebody who's got a tracheostomy is suctioned. These are procedures that generate a lot of these very fine aerosols, and so potentially can increase the risk of cross-infection. So these respirator masks are used during aerosol generating procedures with those diseases because they will filter out the aerosols. What's really important is any one of us can wear a surgical mask. It needs a bit of training. You've got to use it correctly, and we're going to see some funny, well, not funny, some fairly worrying images later. But you don't need a huge amount of training to wear a surgical mask. You put it on properly, you take it off properly, you wear it properly, that's about it. Respirator masks, you have to do all of that, but you have to be fit tested because we all have different shaped faces. Men tend to have bigger shaped faces than women. We need to find a mask that is going to fit us as an individual, because the mask that fits me might not be the same make as the mask that fits you. And we both, if we're doing an aerosol generating procedure, we both have to wear the correct mask. So respirator masks really are only used in a fairly limited set of circumstances by a fairly limited group of staff. We're really talking about staff who work in hospitals. And also in Sandwell, we've got a couple of care homes that are nursing homes that they do have residents who've got tracheostomies, and the staff working there will suction, and so they're doing aerosol generating procedures. So they will need to wear respirator masks, but really most people, it's surgical masks. Any questions on the respirator masks?
Nothing on the chat, Valerie.
Lovely. Now, I want to talk about face coverings. Face coverings are not PPE, so I did and ah about whether I should put them in or not, and I decided I had to because we're all wearing them at the moment. But it's important to say that face coverings, we don't consider them to be personal protective equipment. The reason being, masks, whether they're surgical or respirator or gloves or aprons, they're all made to recognise standards and they are CE marked. And of course, face coverings aren't. And I know a few people are setting up cottage industries making face coverings at home. So we don't consider them to be personal protective equipment. And unlike PPE, where we know they have a proven level of protection, we don't have that same degree of certainty with face coverings. But there is some evidence, it's a bit weak, but there is some evidence that they are effective at blocking droplets. So if somebody is wearing a face covering, there is some evidence that that face covering will prevent that person releasing their droplets into the wider environment. And I'm going to come back to face coverings in a moment because I'm going to talk about COVID-19 and what PPE we use for COVID-19. So I'll mention them a little bit more there. PPE is not a magic bullet. As I said earlier, it's the last kind of control measure. PPE has to be worn correctly. If it's not worn properly, not only is it not effective, it actually could increase the risk of infection to the person wearing it and to others. So PPE must be worn correctly. If it's not, it can be dangerous. But there's other challenges as well. Anyone who's worn gloves for any length of time will know that they are uncomfortable. They can irritate the skin, they can cause contact dermatitis and skin problems. Quite a lot of PPE contains latex, and latex allergy is a real issue. So that's something to bear in mind as well. And again, it can be very uncomfortable. I've worn this kind of PPE and it's fine for the first 5 or 10 minutes. But after 20 minutes, an hour, 2 hours, it is incredibly uncomfortable. It is hot, it's sweaty, it's claustrophobic, it's not pleasant. So people who are wearing it for any length of time, it's not a nice thing to do. You can get quite dehydrated quite quickly, especially in hot climates. It can affect your vision. You know, if you've got masks and visors and goggles and things, it can limit your vision. And of course, PPE has got to be removed correctly. So not only has to be worn correctly, it's got to be taken off correctly. And actually taking off PPE is quite a risky procedure because if the PPE is contaminated, which it probably will be, if we don't take it off properly, we risk contaminating ourselves. And certainly during the Ebola epidemic in several countries in West Africa, there were several recorded cases of healthcare workers becoming infected with Ebola, probably when they were taking off the PPE that they were wearing to protect themselves. So PPE, you know, it does have its challenges. It absolutely has benefits, but it does have challenges as well. So I'm now going to talk a little bit about PPE for COVID-19. And I'm going to talk about it in 2 main contexts. So first of all, in health and social care, and then more generally and more widely. Now, we don't cover hospitals. Hospitals have their own infection prevention and control teams. But we as a local authority, of course, we do commission care homes, we do provide care, we provide domiciliary care, day care. And so a lot of this is very directly relevant for many of the staff working in the council and of course for the wider public health. Now this is for health and social care only. Okay, so this is not wider, but this is a really nice infographic explaining what PPE is required in health and social care. As always, there's a load of references on the side there. There is more guidance than you can shake a stick at about PPE and COVID. If you're interested, I do recommend you have a look in more detail. But basically, if you are working in a care home or if you're a carer going into people's home to provide care, this is the PPE that you will need to use. So general contact is on this side here. So a carer coming into contact with somebody who has or may have COVID-19, that person would want to wear gloves. They'd want to wear a disposable apron. They might want to wear eye protection if there was a risk of splashing, and they would want to wear a fluid-resistant surgical mask to stop those droplets entering the nose and the mouth of the person wearing it. So that's the PPE required for contact with a confirmed case. Apron, gloves, surgical mask, and maybe eye protection. If you're then doing an aerosol generating procedure, and most people won't be, but there are a couple, as I say, a couple of nursing homes in Sandwell that do, it's a riskier procedure because you're producing these aerosols that will contain the virus. So you want gloves, but you want a gown. You don't just want the apron, you want this long fluid repellent gown that covers the arms and covers the neck area as well. You would definitely want eye protection, and you would want the respirator mask. You want the tight fitting mask that you've been fit tested in how to use that is going to filter out any aerosols. So that is the main types of PPE for contact with cases or suspected cases of COVID-19 in health and social care.
We've got a question.
Yeah.
Catherine just asked, is there any kind of standards that we should be looking for when we're buying surgical masks?
So there are, I've not really covered it in this presentation, but surgical masks, Linda from my team, she did a really good guide, which we can send round. But basically they need to be CE marked, and they need to meet several required standards, of which I can't remember off the top of my head, but they do need to be CE marked. Early on, back in February and March, we had real problems because there were massive shortages of PPE, and that was a really big issue. And so there were lots of local businesses, coming up with their own homemade things, and that would have been great if we'd have got into the absolute dire straits of literally running out of PPE. But I don't think we ever did. Unfortunately, now we're in a much better place, both locally and nationally. We don't have those shortages of PPE. So certainly, face coverings aside, but any aprons, gloves, masks, visors should all be CE accredited, and they should be medical devices. And I can send more information out at the end of the session about that. So that's a very simple visual guide, but of course it's not that simple. I'm not going to go through this table in any detail. You will get it in the slides that will be sent out shortly. But this is the references at the bottom, but this is table 2, and this is what PPE should be worn in social care and domiciliary care. And it talks about in an individual's own home, you would wear gloves, apron, a surgical mask, and you might wear an eye protection. It talks about aerosol generating procedures. So there's lots of possible scenarios there about what you might do. What happens if it's a home birth? What do the midwives need to wear? That sort of thing. But of course, there's more than 2 tables. This is also table 4, which does slightly contradict table 2, which is rather interesting. But this talks about sustained transmission of COVID-19 in health and social care. And really, this table was introduced a little while ago, and it kind of got sneaked in by PHE. And this is what they recommend that health and social care staff wear during periods of sustained transmission. And this table was published, but it was then another week before they said, yes, we're now in a period of sustained transmission. So that was a little confusing at the time. But really, this is saying that if you're working in health and social care, because we've got sustained transmission of COVID-19, we have to assume that anybody potentially is a case. So this is saying that in any setting, if you have direct patient or resident care within 2 meters, you will wear gloves, apron, a fluid-resistant surgical mask, and face eye protection if there's a risk of splashing. So even if somebody's working in a care home where nobody's got any symptoms and nobody's a confirmed case, they should still be wearing the PPE because we're in a period of sustained transmission. And it also talks about what people should do if they're taking somebody in an ambulance to an appointment, for example. So I don't expect you to memorize this, obviously that's not possible, but these tables are there and they're very useful. So whenever a query comes in about what PPE do I need to wear in this circumstance, the reference there takes you to, I think there's about 6 or 8 tables in total, but table 2 and table 4 are the ones that are most relevant for us as a local authority. I did want to talk about donning and doffing PPE because I mentioned it earlier, but it's incredibly important because PPE only works if it's used correctly, and if it's not used correctly, it won't work, and actually it could make matters a lot worse. So, this is a useful guide. Most of you don't wear PPE or haven't worn PPE, but there's a way of putting it on. So when you're putting it on, you make sure that your mask is tied securely. It covers the nose, the mouth, and the chin. The gloves go on last of all. And then you go and do whatever it is that you're going to do. And then doffing, taking off PPE, this is the most important part. And this, as I said earlier, this is quite risky because if you're taking off gloves and you've got COVID-19 and if you've got virus and pathogens all over your gloves, you've got to take those gloves off carefully to make sure you don't contaminate your hands. So gloves are taken off in a way that you don't touch the outside of the glove. They're peeled off, putting the finger underneath to take it off. After gloves are removed, the hands are cleaned and the apron's taken off. And again, the apron, it sounds obvious, but you don't take the apron off over your head because if there's anything on your apron, it's now on your face and in your hair. So you snap the ties and you pull the apron off, not taking it over your head. And then you take off your eye protection, you clean your hands, and you take the mask off last of all, and then you clean your hands. And you can see that, that cleaning hands is quite a regular thing throughout taking off PPE. It's very important that we do that because you've got to assume that the PPE is contaminated. And if you're not cleaning your hands, then your hands are also contaminated. So none of you are expected to be teaching, Claire and Linda aside, none of you are expected to be teaching people how to put on and take off PPE. So don't worry about that. But you do need to be aware that it's very important it's done correctly because actually it's quite a risky procedure. Sessional use. I did want to talk about sessional use because earlier on I mentioned that a while ago there were shortages of PPE, and this was a real worry. And the PPE that hospital staff and care home staff and domiciliary carers needed just wasn't available, and that was putting staff and patients and residents at a real risk. So I think it was April or May. I think it was April. The concept of sessional use came out. Now, prior to that, there was an absolutely hard and fast, ironclad rule that PPE was always single use. You used it, you took it off, you threw it away. That was it. That was absolutely sacrosanct. It was the rule. And then April time, I think it was, PHE, in conjunction with the Health and Safety Executive, made a very pragmatic decision that because there are shortages, we are going to allow face masks to be used for sessional use. So if you're working in a care home, and say you're in the dining room and you're helping several people with their lunch, you can wear the same mask throughout that whole period of time. Gloves and aprons are always single use. So if you help Doris with her lunch, you take off your gloves and apron, clean your hands and put on new gloves and aprons before you help Roger with his lunch. So gloves are always single use, but the mask can be kept on for a longer period of time. It was a pragmatic decision. It was introduced when there were shortages. It's inherently risky. I do feel a little bit uncomfortable with this approach. And I think that the biggest risk is that people think that gloves and aprons can be used in this way, and they absolutely cannot. Masks can, gloves and aprons cannot. So yeah, just to be aware of the concept of sessional use and PPE. Any questions about that or about PPE in healthcare in general?
Valerie, we've got a question in the chat from Elizabeth Stevens. She just said, when I visited the care homes, they were leaving them in a bag between use or stuffing them in their pocket. Has this stopped?
It should have stopped. And I'm going to talk about misuse of PPE shortly, but yes. So if a face mask is taken off, it gets disposed of. What you should never see is somebody hanging a face mask over a door handle to use later, or putting it in their pocket to use later, or dangling it around their neck to use later. It's either on your face or it's in the bin. It's either being used or it's not. So that, I'd like to say it would have stopped, Liz, but obviously I'm not in every single care home, so I can't say that for sure, but we've certainly been giving that message out. And I'm going to talk a little bit about misuse of PPE as well.
Yeah, Ali's just put a question, he's put taking off PPE. Could you go through that, please? Yeah.
So taking off PPE. So you take off your gloves first of all, and you do it in a way that you don't touch the outside of the glove. You throw the gloves away, you clean your hands. You then take off your apron, and you do take the apron off in a way that you don't take that off over your head. So that's this one here. And then you throw the apron away into the bin, and then you take off your eye protection, clean your hands, and then you take off the surgical mask last of all. And the surgical mask, I don't think I mentioned this earlier, but you never touch the front of the surgical mask. The only bit of the surgical mask you touch are the straps that go around the ears, because the front of the mask you've got to assume is contaminated. So you touch it by the straps and take it off that way, and then you clean your hands. That's the procedure for taking off PPE. And there's more information about this in the links that's in the presentation, Ali. So that's PPE in healthcare. So PPE now everywhere else. Generally, it's not that there's no such thing in health protection as an absolutely hard and fast rule. You can't say something's the case 100% of the time, but really PPE is generally only required in health and social care activities. So domiciliary carers need it, staff working in care homes need it, in hospitals, staff working in offices really do not. So really the Health and Safety Executive have come out with some really good guidance, and it basically in a nutshell says that if you're working in a non-clinical setting, the only PPE required is what you needed before COVID-19. So if you work removing asbestos from old buildings, for example, then clearly you're always been wearing PPE to protect you from the asbestos, and you'll carry on doing that. But if you're working in an office, you don't now need to wear gloves and aprons and a face mask while you're working in the office. Now, the exception to that is obviously face coverings. But as we've already said, face coverings are not PPE, they're just face coverings. And the guidance there is that face coverings should be used if you can't maintain social distancing. And obviously they're mandatory on public transport, and from the 24th of July, they will be mandatory in shops as well. And they're not PPE, but there is some, although it's weak evidence, there is some evidence that they do prevent droplet spread. So face coverings do have a role to play when social distancing can't be maintained. But you should always be trying to maintain social distancing. So we kind of talked about this already. PPE must be removed once the task or the session is finished. You take it off safely, and you immediately dispose of it. Or if it's a face covering that can be reused, or a plastic visor, you clean it, you decontaminate it, and then you always clean your hands afterwards. And hand washing is incredibly important here. So the removal and the disposal of it is crucial. And as Liz said, you know, staff shouldn't be, you know, taking their mask off and saving it for later. If you've taken it off, it goes in the bin, is the rule. Now, I want to talk about misuse of PPE, and this is something that I see the public do every single day, but it's not just a problem with the public, it's a problem with healthcare staff and social care staff as well. And actually, Jenny Wilson, who's a professor of epidemiology, she a couple of weeks ago came out and wrote something in the Health Service Journal because she was quite concerned about misuse of PPE, particularly in critical care in ITU environments. And she was saying that the widespread use of PPE has exacerbated the problem of patient-to-patient transmission. And basically what she was saying was that, you know, there's evidence of staff using the same pair of gloves in between different patients. Well, gloves will be contaminated, you can't clean gloves. Or there's evidence of staff wearing several pairs of gloves together, thinking that that's somehow safer when it's not. So it's important to remember, though PPE can be incredibly effective at keeping us safe, if it's misused, it can lead to the transmission of infections. So it's got to be used properly, and it's got to be used correctly. And misuse of PPE is a real problem. So just for the last 5 minutes, there are some really good myth-busting slides on the WHO website to do with COVID-19. To all sorts of things, you know, 5G, is Donald Trump's idea about drinking bleach a good idea or a bad idea, that sort of thing. They've got some really good information there. But there's a couple on there that relate directly to PPE. And one of them is about masks and exercising. And as you see here, WHO say that people shouldn't be wearing masks when they're exercising, because the mask is going to get quite wet quite quickly as you get sweaty, and a wet mask makes it difficult to breathe and actually could promote bacterial growth. And the important thing with exercising is social distancing. So WHO says a metre. In the UK it's 2 metres, ideally a metre and a bit if possible. So you shouldn't be wearing a mask when you're going for a run or when you're on your bike. You should be maintaining social distancing. That's far more important. Another one, another myth that's doing the rounds is that if you wear a mask for a long time, you're going to become deficient in oxygen, or you get a buildup of carbon dioxide and you'll become intoxicated. And that is a complete myth. Medical masks do not lead to oxygen deprivation, and they do not cause carbon dioxide intoxication. So that's a complete myth. It's not true. Now, some people can't wear masks. If you're asthmatic, or you're short of breath, or you have COPD, you might not be able to wear a mask or a face covering, but they don't cause oxygen deficiency. So that's a complete myth. And then the final myth busting is, it goes back to the shoe covering one earlier on. And I think there must have been a bit of a myth that shoes can spread the COVID virus. Well, they can't. You know, as I said earlier, the floor is always dirty. So if you've got small kids in the house who are crawling around on the floor, it's probably a good idea to take your shoes off at the door. But I imagine that's more significant to do with any dog poo that you might have walked through than the COVID, the SARS-CoV-2 virus. So yeah, shoes aren't really a vector to spread COVID-19. So that's just a little bit of myth busting there from the WHO. So now I want you to turn on your microphones. We've now got a few slides about common PPE mistakes. So what I'm going to do is show you the slides, and I want people to shout out, or if you're a bit shy, you can put it in the chat box. but shout out what the problem is. So, what's the problem here?
Not covering the nose.
Nose, not covering the nose.
Absolutely. So it's not covering it. It's not even covering the mouth, is it? Look, you know. So, you know, any droplets that she's releasing are not being blocked by this mask, and any droplets that anybody in the vicinity are releasing are not being blocked by this mask. So that mask is completely useless. She may as well not have it on. Absolutely. What's wrong here?
Social distancing.
So no social distancing, absolutely.
Also, the lady's not covering her nose again.
Yeah, so this lady here, she's got a face covering on, and that it looks to be covering her nose and her mouth. But this lady here, she's got a face covering over her mouth only, but not her nose. And they're obviously wearing them because they can't maintain social distancing. But this is clearly an office environment, so I would say, why on earth can't you maintain social distancing? And that face covering is not covering her nose, so it's doing no good whatsoever. So yeah, that's not a good situation at all there. What's wrong here?
Wow.
Eyes on the face, all in the
Where
face.
to begin?
Well, there looks to be a hole in the one mask, which
Yeah.
makes it useless.
Yeah, so this mask has got a hole in it, so she can drink her lemonade or gin and tonic or whatever it is. So
That's Tenet in disguise.
yeah, so that face covering is obviously not effective because there's a great big hole in it. What about this chap?
It looks like
He's
he's a bib.
He's got it under his chin.
And covering us all.
Exactly. So it's a chin hammock more than a mask, isn't it? It's not covering his mouth. It's not covering his nose. He's also got a drink and some food there by the looks of it. So in both cases, I would say if you're concerned enough that you think you need to wear a mask or a face covering, and in that environment you're in, you think I need to wear PPE to protect myself from any droplet contamination, why are you putting something into your mouth? So if you're so worried about droplet contamination that you're wearing a face covering, sticking a straw into your mouth is probably not a good idea. And the same with this guy here as well. So yeah, they're doing the mask and the covering, they're doing no good whatsoever. And by eating and drinking in this way, you're potentially introducing droplets into your mouth. Absolutely. What's wrong here?
He's wearing gloves.
Gloves, absolutely. His mask, he's got his mask on fine. That's looking good to me. But he's coming into contact with apples. He's not coming into contact with blood or body fluids. So why has he got his gloves on? So gloves become contaminated just as easily as the skin on our hands. But unlike our bare hands, you can't clean a glove. You can't decontaminate a glove. And people who go around the supermarkets wearing gloves, they're not protecting themselves because the glove will be contaminated just as easily as their skin will be. And actually you can't clean those gloves, so actually you're putting yourself more at risk. So he is increasing his own risk by wearing those gloves, not decreasing it. So there's no need to be wearing those gloves at all. But the mask, he's got that on, fine. What's wrong here?
She's touching a mask.
Touching a mask, absolutely. The only bit of a mask you should ever touch, when you put it on in the first place, you're going to fit it around, so it's fitting fairly well around the nose. But once it's on, the only bit you should ever touch are the straps around the ears here. You've got to always assume that the front of the mask is contaminated. And by touching the mask, anything that's on the outside of the mask is now on your fingers. And then if you put your fingers in your eye or do something, you've now contaminated yourself. So yeah, you should never be touching the front bit of that mask. And then final, what's wrong here?
No social distancing, no masks.
Everything's wrong with that, Valerie.
Yeah.
Yeah, quite literally everything. So we've got a mask, a chin hammock there, it's not covering the nose or the mouth. We've got a chin hammock there, it's not covering the nose or the mouth. It looks to be similar issues here, here and here. It doesn't appear to be much social distancing going on. It's obviously a bar area because people are drinking. Well, if you're eating and drinking, you can't wear a mask, which is why they're all round their chins, because you can't wear a mask and drink something at the same time. So really, this situation, the social distancing would be far more important in this kind of situation, and people are clearly not adhering to the social distancing. So yeah, there's a lot wrong with that situation. So really, PPE, it can and it does protect the person wearing it and other people. However, it's the control measure of last resort. Measures like social distancing, isolation, quarantine, hand hygiene are all more important than PPE, although PPE is important. And if it's used properly, PPE is very effective. But if it's used incorrectly, it can actually increase the risk of infection. So that is it from me. Thank you all very much. Does anyone have any final questions?
Nothing on the chat, Valerie.
No, there's. I'm interested to know the answer for Sandra's question about the supermarket and gloves. There's a comment on the.
So I can't see the comment, Sally. What was the question?
It says, with gloves in supermarkets, is there an argument that you can take off the glove before you get into the car to reduce the risk of contamination in the car?
You could, but you could also gel your hands before you getting into the car.
Yeah.
And also, where are you going to put the gloves? Gloves are really good at protecting us from contact with blood and body fluids, but we're hopefully not coming into contact with blood and body fluids in the supermarket. So if you go around the supermarket wearing gloves, they will be contaminated just as equally as your hands would be, but at the end you can gel your hands and that will kill anything, any virus or any bacteria that's now on your hands. But by taking off the gloves, you might contaminate your hands by taking them off. You might not clean your hands after taking the gloves off. People get lulled into a false sense of security with gloves. So I would argue that they have no role whatsoever in the supermarket, and they're probably increasing risk. Any other questions from anybody?
Valerie? Yes.
You
know, with regards to the face coverings, because I think the face coverings is the sort of the dodgy area, because with regards to sort of masks and things, there's guidance.
Yeah.
But the face coverings, just to say, well, you've got to cover your face if you're on public transport. You've now got to cover your face if you go into shops, you know, as from July and whatever. Is that, you know, you've just said about like not touching the outside of the mask and all the rest of it. There's no real guidance about, you know, especially with like washable masks, people will take them off, put them back on again, and they will be touching the outside of the mask, the face covering.
You're right, and I think what we have to do is treat face coverings the same way as we would PPE, so a mask. So I'd say with a face covering as well, you know, so say you're going to the supermarket, you put on your face covering over your face, you go around the supermarket, you don't touch the outside of the face covering, it's on your face, you don't fiddle with it, you don't move it aside to eat a bag of crisps or have a drink, you leave it alone. You go around the supermarket. When you leave the supermarket and you're in the car park, you take it off in the same way you would a mask. So by the sides only, you don't touch the front. You then put it into a bag, you know, and that's your dirty bag. And then when you get home, put it in the laundry and it can get washed that way. So I think that the principles are the same, which is remove it once the task is finished, remove it safely, don't touch it, and then either throw it away, or if it's a face covering and it's reusable, shove it in the washing machine and then clean your hands afterwards. So I think we can take the principles from PPE and apply it to face coverings.
So is there going to be guidance from government, or you have adverts that tell you about about washing your hands and all? Is there going to be sort of adverts and public notifications about how to wear face coverings safely? Because I've seen people, they put their fancy face mask covering on, and then they take it off, put it in their bag, pull it back out again when they go in the next shop, and they have no, and it's not their fault, they just have no concept of how to keep safe.
I think as well, it's I don't know if there's going to be or not, Di. I think there should be, and I think I on a lot of social media I've seen things, well, PPE is not rocket science, people can get it right, but it's not easy to use. It takes, even wearing something like a face covering, it does take a little bit of knowledge and training in how to do it. And if we don't tell people you shouldn't be putting your mask in your pocket to put it back on again 5 minutes later, then they won't know. I hope there will be some kind of national campaign. And actually, I'm wondering if it's something, I don't know if Chitra's on the line, I'm wondering if it's something that we could do locally, a bit of a social media marketing campaign about how to use face coverings correctly, that sort of thing.
Yeah, sorry, Valerie, it's Chitra. Yeah, there is. PHE have done some stuff on this, and we have tweeted and Facebook shared stuff around how to put face coverings on properly. But we can certainly either push those out more or get something local developed if we think it's locally a message we want to amplify.
I think so, because as we know, we've got an increasing number of cases in Sandwell, so we want to be doing absolutely everything we can to do that. And if people are using face coverings incorrectly, then that might lull them into a false sense of security. They don't maintain social distancing, they're not doing the other control measures that they really should, because they're putting too much reliance on an incorrectly used face covering. So I think that's probably a really good idea. But let's do that.
Valerie, a question from me. Your our earlier conversation on this in terms of mask against face covering. What is your position in terms of which is best outside health and social care, considering that the supplies is not a big issue at the moment?
I think outside of health and social care, I don't think that PPE is required, and that includes masks. I think there is I used to be very against face coverings. I'm not entirely convinced, but I think the evidence is getting stronger that they do have a benefit. But the benefit of face coverings, the evidence is a bit weak. But if they're used correctly, then yes, they and appropriately, then yes, they will. So I think face coverings in the general setting are absolutely fine, providing they are used correctly, and that's the same with PPE as well. So if I were going, I mean, obviously we have to on public transport, and we will have to in the supermarkets. But if I were, going to somewhere where I couldn't maintain social distancing, I would wear a face covering, and I know that it would provide some degree of protection.
Valerie, do you know if employers can insist that their staff wear face coverings if they're not working in a healthcare setting? So if they were just in an office setting?
So they can't insist. So PPE is one thing. So if you're working on an intensive care unit doing an aerosol generating procedure, the employer is by law required to provide you with the PPE that you need. But let's say in an office environment, no, the employer can't insist, but then equally they can't stop somebody from wearing a face covering if they choose to do so. But the important thing is that from the employer's point of view is that they're introducing all the other control measures like social distancing, like ensuring that there's enough sinks and alcohol gel points to clean their hands, because those are far more effective than a face covering. So no, I mean, what will be interesting is, because I know there's been a lot of talk in the media about you know, the face coverings in supermarkets and in shops, and who's going to police that? And the police are saying, well, you know, we can't, the supermarkets and the shops need to do it. And the shops are saying, well, it's a bit difficult for us to do that. You know, are we going to stop people coming in if they don't have face coverings? So it's going to be interesting to see how it all plays out.
Thanks.
Any other questions from anybody?